Okay, so this is the pronation and supination stretches. We have pronation like this, supination like this. The way to remember that is when it's supinated, it's like a bowl of soup, and you just hold it for 10 seconds, 10 times each direction. All right, this is the flexion and extension stretch for the wrist. And so you can use your other hand to do extension like this with the fingers open and also fingers curled, just to get different stretch in the wrist and forearm. And then you also have flexion going down, and you can use your hand to deepen the stretch. And you can also do fingers open and closed for this stretch as well. This stretch is radial and ulnar deviation. So you'll push down like this for ulnar deviation, pushing down towards the pinky, and then you'll push up for radial deviation, pushing up towards the thumb. All right, this stretch is called elbow extension and flexion. And a lot of times with this, the patient will have limited range of motion, so they'll feel the stretch as they're extending. They might not be able to strain it all the way. They can put a weight in their hand and just kind of hold it and let it stretch out, get a little bit more extension, or they can hold it themselves just to get the stretch. So this is extension, and then flexion, just bending the elbow and holding it. All right, this exercise is wrist flexion and extension. They can do it with a weight. So you have flexion, just curling like this, and then extension, curling like that. Or they can do it with the band, just wrapped around their hand, and then same directions, just pulling up like this. All right, this is wrist extension and flexion isometric. So what you'll have the patient do is put this band around their hand, and they're just gonna hold it like this for 10 seconds, 10 times, doing extension and flexion like this. And then you can also do eccentric with the band, where you don't have any resistance and they go up, and then slowly let it down. This would be extension, eccentric. And then same thing with flexion, eccentric. No resistance, they bring it up, you add resistance, and then slowly go down for flexion. And this is how you would do the eccentric ones with the weight. So they use their other hand to help it come up for extension, and then slowly go down. And then for flexion, you have the other hand help them bring it up, and then slowly go down. This is radial and ulnar deviation with a weight. So you'll just, for radial deviation, you'll just bring it this way, back and forth, 3 sets of 15. And with ulnar deviation, you'll flip it to the other side and bring it up like this, 3 sets of 15. Band, you just use the band to add resistance to the hand. So you can bring it down like this, and they bring their hand up and down like this. And then you go the other direction for ulnar deviation, bringing it down. All right, so this is the putty exercise. So you'll get some of the Play-Doh that we have in the supply drawers, and you'll just get a piece about this big. You might have to warm it up for the patient just so that it is a little bit softer. And they'll just put the putty in their hands and just squeeze. All right, this is the rice exercise, and we keep this container of rice and the bucket behind the PT's desk on the top shelf. So what you'll do is you'll take the rice and you'll dump it in here so that it doesn't get everywhere. Then the patient will put their hand in, and there's 2 ways to do it. The first way is squeezing. So they just kind of squeeze the rice between their fingers. Then the second way is splaying. So they'll start with the fingers together and then splay out like this. Let me get the rice off my hand. Okay.
Go ahead.
And then when you're done, you just dump this back into the container and put it all away. All right, this is the TheraBar, and you can do all the different directions with it. So you can do flexion and extension like this. And you can also do radial and ulnar deviations like this. All right, this is the gripper. And the exercise that we have the patients do with it is they just grip it like this and do 3 sets of 15. And then to adjust the level here, based on what the patient needs, you'll squeeze together and pull this pin out So then it releases and you can move these to the different levels depending on what the patient needs. All right, this is the handheld dynamometer, and what it does is it measures grip strength. So usually the therapist will use it with the patient on their first visit or for follow-up visits if they're trying to assess if anything's changed. So usually the patient will hold it in their hand like this, right at their side, and they're just gripping as hard as they can while it measures. Normally they'll face the dynamometer towards the therapist so they can read it as they're squeezing. And then if you ever need to reset it, you just turn this knob in the center back down to 0. This is the Pronation Supination Bar. And what the patient's gonna do is rest their arm on an armrest or a table, and then they just go back and forth between pronation and supination like this. You can also add a weight to make it harder. So you just push this up so you can slide the top one off. You add a weight, usually we'll put about 1 pound to 2 pounds on there. And then the same thing, just going back and forth between pronation and supination.
This exercise is called tree huggers. They're also known as awkward hugs. So you'll huggers are like reach forward like you're hugging a tree. It's 100% a fly. I don't know what he calls it, tree huggers. It's just a fly. Exercise is called tree huggers or awkward hugs, but it's basically just a fly. So you have the bands behind you and you make a circle. Supination stretch. Okay.
Okay.
This exercise is This exercise is called the Pronation Stretch. This is the Pronation and Supination Stretch. For pronation, okay, this is